Good morning. It is Monday, May 4th for our daily press briefing. I'm Bob Ravenscroft, the Vice President for Advancement at Bryan Health. Just want to start by saying thank you. I don't know if it was because of some of the things we shared on Friday or if it was purely coincidence, but we ask for your continued help and awareness around how to stay safe, how to cope with this, so forth. And I saw stories or read stories on, how the Muslim population is doing stuff for Ramadan differently. Thanks for highlighting that. There were great stories on how to decrease anxiety, another kind of doubling down on prevention steps, and then also a nice article on how some churches are remaining to continue with online schedules. Again, Cinco de Mayo is coming up tomorrow, Mother's Day at the end of the week, other events that are seasonal, so I have to think it helps that when the media helps share these stories about how to weather this, it has to have impact on some. So thank you. I'll get right to the numbers before John gives you a little bit of insight into what's going on with our first day of elective surgeries and some things that are going on within the testing arena. So our midnight census at Bryan was 340. With Bryan Easy Visits, we have now crossed 12,000 individuals taking the questionnaire, the screening questionnaire. 4,035 have resulted in Bryan Easy Visits, and the COVID promo code was utilized by 1,906 people. The numbers continue to go up. I think what is developing in members of the media, I know you've picked up on it, that we're kind of a leading indicator for what's going to be reported by the state later. But in total now, we have tested 4,089, conducted 4,089 tests, and we are now at 490 positives, 3,326 negatives, and 273 pending. Most of those were from our drive-through clinic on Saturday, where we had both the morning and afternoon sessions. So, obviously of those 490 positives, they're not all Lancaster. The bulk of them are. I would say they're coming from Saline, Gage, Seward, in addition to Lancaster, but 490 positives at this point. So with that, I'll turn it over to John.
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center. So we have 17 positive COVID patients in-house today. 8 are from Lancaster County, 9 are from outside of the county. 9 of those individuals are in the ICU, 2 are in our progressive care, and 6 in our general care. As Bob shared the numbers with you, it's amazing to start to see some of the consistency. So through our drive-through, we've had 9.9% positive. Through the hospital, we've seen 10.5%, and through urgent care, 10%. So you see that real consistency of about 10% of the people being tested are positive. Our mobile is our outlier at 34%, and that's primarily because we focused in one area in focusing in Crete. Our elective surgeries, today we're up about a dozen surgeries. Those are the one-day stays. A majority of the people that are going to have elective surgeries where they don't need to stay overnight will probably be done in the doctor's outpatient surgery center. So we've seen an uptick in that area as well. With our mobile unit, right now we don't have a plan for this week. We do believe that we'll be going to a location in Lincoln, but further, outcomes of that will happen later on this week, where we'll be able to tell you our exact location. We don't plan on going to Crete right now unless they ask us to go to that area. But with that, we'll take any questions that anybody might have. I have not looked at our state trends most recently, but I think we were around 8.5 to that 9% range. So we might be a little higher at this point in time, but I know some of those results have been coming in a little bit slower over the weekend, so we might be right in the same vicinity. National trends, those are really hard to take a look at because you do have specific hot spots throughout the nation, so that's a real tough one to do a comparison when you're looking at just how Nebraska sets and compared to the entire nation. and I do believe we were at 115 came from the mobile unit of the 338 that we had tested.
Some of the people that were treated at the mobile clinic in Crete doesn't mean that they are Crete residents. There are a fair number of Lancaster County residents that commute.
I would say dozens. And that's the nice thing that we can say is that even though these people are identified as positive, a lot of them have mild symptoms. So there's people that would come and be tested positive that are self-quarantining at home. Once again, these are individuals that are more compromised, that are having to be inpatients inside of a hospital. And we can't stress this enough. These are the individuals that we want to keep people away from and not get exposed. And that's why we talk about this self-isolation and social distancing so much. Typically, you'll see something like a gallbladder being done that somebody may have put off. It could be an elective orthopedic type procedure. It could be carpal tunnel. It might be a total knee type procedure. Those are the ones that are being scheduled right now. And I imagine this will ramp up a little bit throughout the week. But a majority of these other ones that can be done in that doctor's outpatient surgery center, those are the people that are going home literally within hours after having their surgery. I would say we're in excellent shape right now. Even though you hear that we have 17 positive COVID patients in-house, we have the capability of literally handling hundreds. And that's a good sign that our utilization right now is pretty low. As we look for this peak, and again, it fluctuates between about the 11th and the 13th of May, but realize as we flatten this curve, the peak isn't as big a peak as people believe it will be, long as we continue to flatten the curve. And I just want to reemphasize again, you guys, we've got two important dates coming up, Cinco de Mayo and Mother's Day, and we've got to make sure that we abide by the guidelines that we've been giving out to people. It's extremely important.